Do we have someone
You're
else?
right. No,
Is there someone else?
you've got it.
Our last presenter is Kevin Fitz, who I believe is here. And thank you so much to our American Sign Language interpreters today. Very grateful to you. Welcome.
Good afternoon, Chair Patterson and Senate Healthcare Committee. My name is Kevin Fitz. I'm a volunteer with a small policy group called the Oregon Mental Health Consumers Association. The main mission of the Oregon Mental Health Consumers Association is the inclusion of the recipient in behavioral health and addiction services across our spectrum of federal, state, and regional level. To that end, I'm here to support the expansion of the Health Equity Coalition Bill SB 564. I had some notes, but listening to everybody else's testimony, they whittled away at what I was already going to say. I do want to say I appreciate, Senator Gorsuch, your statement about what do people need. Just a brief anecdote. People hear oftentimes in the press, sometimes electeds talk about people in my class, individuals who live with severe and persistent mental illness. We're going to get these people the services they need. Significant disconnect, and been working in public policy on and off for the last 30 years with the state of Oregon and with the Oregon legislature. The representation of people with psych disabilities, the representation of people who live with addictions or in recovery for that, having a voice in our healthcare systems. We're always chasing the train. We're always chasing it after it leaves the station. Issues around universal health care, task force, representation from individuals who are who are recipients of the Oregon Health Plan, which is 33% of the state's population currently, 1.4 million currently are Oregon Health Plan recipients. And the process of engaging and listening to the myriad of healthcare consumers out there is always a work in progress. And we've been blessed in the past by Representative Greenlick, Representative Kenny Geyer, Representative then Cedric Hayden's work in supporting accountability for our healthcare systems and supporting the voice of the particular perspective of the service user. An awful lot of times that we find, sometimes particularly in healthcare, the surrogate or the proxy, the representative of the nonprofit who's making six figures is speaking for us, healthcare consumers, which may have some benefit and shortcut to save time, but oftentimes they're representing different things than us as a consumer want or need. Particularly, we've seen in the press $1 billion in behavioral health investment above and beyond in the last session. Questions we can't understand currently. What are the outcomes of that investment? Not whether or not we're providing services out there, but are the services making a difference in the individuals whose lives are suffering? And if we don't connect those loops, we're going to continue to miss the target. Is the Oregon Health Authority and our health delivery system suffer from institutional racism? They sure do. But they also suffer from classism, and they also suffer from another word, probably not familiar with, saneism. The idea that individuals who suffer from psychosis or severe and persistent mental illness can't be productive individuals in helping shape and educate government. And I'm very proud. There's a lot of things that OHA needs some tune-ups on, for sure, but one of their primary sparkling projects is the Health Equity Coalition and its ambitions to reach out to all voices and include them and not to lead with damaging ideas of stigma or what is best for them. It's a paternalistic, condescending sort of posture. I'm very optimistic. We have a new Oregon Health Authority director, and we have a new leader of behavioral health. And we also have the support of Senator Hayden and Senate Bill 432 about engagement. That's all I wanted to say here today. I really appreciate that these opportunities exist and that the spark of the Health Equity Coalitions will be expanded and moved across the rest of the state. Thank you for allowing me to speak today, Chair Patterson and Senate Health Committee.
Thank you so much for your testimony. Are there any questions? Thank you so much, Mr. Fitz. And no one else has signed up, is that correct?
That's it.
Thank you, everyone. Our next meeting is next Monday. Do you happen to have we posted next week's?
No, members, Chair Patterson, Vice Chair Hayden, members of the committee, and members of the public, please stay tuned. Agendas for Monday, the 6th, and February 8th should be going out this afternoon. So you'll be able to see what matters are up for public hearing and potentially for work session.
Thank you so much. Well, we're already to February 1st, so we are moving along and through the session here. So hearing no further business, anything for the good of the order? Then we will adjourn our meeting at 2:25 on February 1st. Thank you.